Today I want to talk about one of my favorite herbs to help your brain, to help your gut, to help your hormones even, and to help your muscle recovery and inflammation. And we're going to talk about turmeric today. I'm Dr. Shelley Meyer. Thanks so much for joining me on my channel. On this channel I talk about gut health, brain health, hormone health, functional medicine. I'm a registered dietitian and functional medicine doctor and a family doctor. I have my own functional medicine practice. I've had this channel for quite a few years. So if you're coming here for the first time, thanks so much. If you're coming back, I really appreciate your support. And to further support the channel, I would love it if you could like, subscribe, and hit the bell to be notified when I post a new video, usually every Friday. So thanks so much for joining me today. We are going to talk about turmeric, or however you want to say it. One of the very, influential kind of supplements in our society now, but this herb, it's an herb, has been used for centuries in the Indian culture and in cooking in the Indian culture, and also in Ayurveda in traditional Indian medicine. So it's not like we're just discovering the benefits. Maybe we are in the non-Indian cultures, but they've known about it for quite a long time. So the average Indian diet, they usually get anywhere between like 2,000 to 2,500 milligrams of turmeric per day, but that's the full spice. So let's dig a little bit into the pros and cons, why it's beneficial, who it could be beneficial for, who it might not be beneficial for, or who it might hurt, and the different dosing and types that I like. So starting out with the pros. So like I said, it can help reduce inflammation in the gut and help the gut lining heal. It can help reduce inflammation in the arteries and help heart disease. It can help your blood sugar and lower your blood sugar for like pre-diabetes, or we'll talk a little bit about what diabetics might not want to use it, but it can help improve blood sugar. It can help your liver detoxify. So that's what I love it for, is a lot of times our livers can get kind of congested with our toxic world that we live in, with medications we may have taken, with infections we might have come across, with too much alcohol, all kinds of things. And this can help with boosting liver recovery and muscle recovery. So if you're an athlete, or you shoveling the drive and hurt your back, anywhere in between, turmeric can be very helpful for lowering inflammation and spasms and helping muscle recovery. So a lot of good benefits. Now, what can be the cons? Turmeric can be rough on the GI tract for some people, and I haven't quite figured out who it's going to do that to and who it's not in my patient population, because it's not like a big indicator to know. But except if somebody has active like ulcer disease or GERD, sometimes we know that they might be more likely to react to turmeric. So it can cause nausea, vomiting. Sometimes I haven't really seen a lot of vomiting, but nausea, gut irritation, like reflux kind of symptoms in some. It's a very minute corner of the population that it'll do that with, but it can, bloating, abdominal pain. So if you're having any of that and you've gone like super high dose with your turmeric or curcumin, you may want to cut it back or even stop it altogether. So let's talk a little bit about the spice, turmeric, versus the curcumin extract. That is the potent anti-inflammatory antioxidant in turmeric. So they're two different things. Curcumin is within the turmeric. So that's why, like with the Indian diet, they are getting 2,000 to 2,500 milligrams of turmeric daily, but they're not getting necessarily the curcumin, as much of the curcumin, because they're only really in the actual spice getting 3% curcumin, whereas you look at a lot of these supplements out there that are curcumin, and those are like 95%, they're extracts, so they're curcumin. So your dosing will vary then. So if you're taking straight up turmeric or eating the herb, you may need a lot more for the anti-inflammatory effect than you would of the curcumin. So let's talk a little bit more about that. That can make dosing tricky. So it's hard to know. It depends on what kind you're taking. Like if you're taking curcumin extract and it's 95% or more, you may need a lot less of that to really have that anti-inflammatory effect. You may need only like 60 to maybe max of 600 milligrams, whereas turmeric itself has been studied, thousands of milligrams daily and been safe. The curcumin is a lot stronger, so you probably don't need quite as much of that. But you do want to see how you individually, respond to it. Now, before we move on, because curcumin and turmeric are so helpful for the gut, and I talk about gut health a lot, if you are interested in boosting your gut health and learning more about what might be causing your gut symptoms like bloating, pain, diarrhea, constipation, SIBO, reflux, H. pylori, check out my Trust Your Gut course. It's a lot cheaper than it was before. I have a link down below, and you can get a discount too. So check that out, and let's move on. So who should take curcumin or turmeric? If you have gut inflammation issues, yes. If you have heart disease, you should give it a try. Diabetes, maybe. Now, if you're like early diabetes, pre-diabetes, just poor blood sugar control, yeah, by itself, along with a healthy diet, of course, and exercise, can help to, improve your blood sugar balance. If you are on really heavy doses of insulin, or you have really what we call brittle diabetes, it goes down really easily, you become hypoglycemic, then adding turmeric you'd want to do slow and careful if you did it at all, because it could lower your blood sugar even more. So you want to play around with how it reacts with you. If you have active kidney disease, you would definitely want to talk to your nephrologist or kidney doctor, because it can be contraindicated, meaning you shouldn't take it if you have kidney disease. If you have active gallbladder disease, you shouldn't be taking turmeric or curcumin. And then if your GERD, if your reflux is really bad, it can interfere with some of the reflux medications. So you want to keep that in mind, and it can also trigger more reflux in some people, like I said, not a lot of people. Pregnancy, we don't know exactly, because it can be a blood thinner, so you do want to be careful and talk to your provider about that. And then again, it can be a blood thinner, so if you are on blood thinners, you would not necessarily want to take turmeric, or maybe just make sure your doctor knows and that you're monitoring the activity of how thin your blood is. And then, like I said, what else wants to take it? Liver detoxification, like I talked about before. If you're having liver issues, not hardcore liver disease, then you're in a different category. But if you've had some heavy metal exposure, if you've had some mildly elevated liver enzymes or moderately elevated, you could try turmeric or curcumin. And then for muscle recovery, it's great for that. And the doses, like I said, can vary. If you're on a curcumin extract, go lower and just kind of take it up to a tolerable dose, maybe not going much above 600 to 1200, but that's for short periods. If you're doing it maintenance, you probably want to stick with that 60 to 400 or something like that dose. It's hard because it's not a one-to-one study. They're not one-to-one studies that show all these different doses. And then turmeric itself, if you're doing a whole turmeric extract, you can go higher up to that 2,000 to 3,000 milligram dose. Okay, let's talk about my favorite types of turmeric. Turmeric can be poorly absorbed, or curcumin itself, the active ingredient, can be poorly absorbed, and a lot of supplement companies, rightfully so, will market it with black pepper, which helps it get absorbed. Now, I find black pepper can be one of the irritating agents for the stomach lining, so not always the best if they have a sensitive stomach. My favorite brands are their doctor formulated brands. Turiva by Orthomolecular, that's a whole turmeric extract, so it's not curcumin, but they've done lots of studies, and these two companies I'm going to talk about always do studies on humans. And it's a whole root turmeric with volatile oils, and that's a good thing in it, and it's more of like a spectrum of eating it, but more potent. So they've done studies with RA and gut inflammation, and blood sugar, that it, even at these 250 milligram doses with the Turiva, can improve those inflammatory situations, and you don't necessarily need to go up. And they've also done the studies with 500. It works a little bit better there, 500 of the Turiva, so you could do anywhere between 250 and 500, and that is a whole turmeric, kind of whole root. Curcumin is the one I go to if it's really, we need a potent form. That's curcumin itself. It's hugely bioavailable. You don't need the black pepper in it, and I use it for really high inflammatory situations, like really bad liver, not really bad liver disease, but needing as part of a detox protocol, needing as part of a SIBO or dysbiosis protocol, and then kind of tapering down and maybe switching to a whole turmeric or lower dose of the curcumin after that. And especially for muscle recovery, it's really good for that too. So that's my rundown on turmeric. I hope you enjoyed it. And if you did, please hit the like button. Please subscribe if you haven't done so. Please share this out if you think anybody could benefit from it. Feel free to follow me I would love for you to follow me on Instagram, where I post some of the shorts and some more information there too. And if you want to check out my Trust Your Gut course, there's information down below. And then I will link some links for discounted Curcumin and Turiva on my supplement dispensary, and then also some Amazon links if you just want to find them directly on there, because sometimes that's easier for people. So thanks for joining me, and I'll see you next time.